my presentation today. It's about the impact of the exercise to the to prevent for cancer prevention in rheumatoid arthritis patients. So this one is my first pilot study that I brought the exercise with the cancer prevention. So let's see what's about it. First, I'd like to talk about the rheumatoid arthritis. I'll briefly talk about this. The rheumatoid arthritis is it's autoimmune disease that attack their own healthy cells, and also the symptoms about the pain in multiple joint stiffness, and some patients have a fever in later on. I'm from the exercise science department, so I cannot take these slides away. So this slide will talk about the exercise recommendation for these conditions. It's about somewhat daily physical activity from moderate to vigorous. And also the water exercise is the best exercise for this condition. A lot of cases have shown that rheumatoid arthritis, I mean, like a cancer occur after the rheumatoid arthritis had been diagnosed. So a lot of cases came up to my mind, and I think that, and also I'm from the exercise science, so a lot of patients that come to us with the rheumatoid arthritis conditions and ask us to decide the exercise guideline for them to relieve all the pain in their joint. So that's reason that came up to my mind, that why don't I use the exercise to prevent cancer more than relieve the rheumatoid arthritis, that thing. So that's why I decided to do my pilot study about using the exercise to prevent cancer. And also I like the epigenetic, I fascinated with the microRNA. So that's why I decided to choose the microRNA to be by biomarkers to see that does the exercise really affect the cancer occur or not. I don't know what's going on with the slide, so well, that's okay. So let's talk about the microRNA a little bit. The microRNA, it's about 20 to 22 nucleotide long, and the microRNA is one part of the epigenetic. So the microRNA can be changed depend on the the change from the many factors like external factors and internal factors. So external factors about the physical movement, physical activities or exercise, or some kind of environment. And also in the internal factors, about the cell's environment can change the microRNA regulations. So this is a sample, down here. Down here, that's just a sample about the microRNA regulation during the exercise. Some of the microRNA are upregulated and some are downregulated during the exercise. So, if somebody asks me like, hey, this microRNA 21 can be upregulated during the exercise, I said, well, I cannot tell because microRNA regulated, upregulated, or downregulated, it depends on individual. So, well, let's see. It's even my research data from me or in another person. Well, we have different microRNA regulations. Oh, this is my paper that published last year. So what? This is my colleague. So we did this study together, and this actually is a pilot study. So we're going to do it further in the future about in deeply about this kind of a study about the rheumatoid cancer and the exercise. For the methods, I have 12 male rats to be my samples in my study, and I divided into 4 groups and 3 rats per group. One is an exercise group, another one is non-exercise. The third group is an exercise with the PAA. PAA stands for persistent-induced cancer. And I injected about 100 microliter in the rat tails, and and the last group is non-exercise with the PAA. So in the exercise group, the rat ran about 20 to 25 meters per minute, and the rats could be rest about 15 minutes when they show fatigue sign. And also at day 45, our rest were utilized by the CO2 inhalation. And after that, all the blood were withdrawn from the extraventricular vein, about 5 cc, and stored in EDTA tubes. Also, we extract the total RNA and amplify by PCR using 5 and 7 primers, and also we use the computerization to see the microRNA expression and the target genes. And this is what we found. I compared the study group together, and then, well, I found the 213 significant microRNA for all study groups. And also I compare, and I select only 4 microRNA and 4 target gene from each comparative study group. And this is what the 4 microRNA and 4 target genes is about. I will discuss this about this later. So, well, we found like a microRNA 877, the target ITPR3 genes, and this is the upregulated, and the rest are the upregulated microRNA. It's microRNA 466B43P, target SOCS6 gene, and microRNA 12823P, target ITGA9 gene, and microRNA 36643, target NKX21 genes, that which relate to leukemia, lung cancer, and proteoglycan cancer. Well, that's what I told you previously, that my study was the pilot, and my first pilot study, that I did something different from exercise science study. So I put the microRNA to be my evaluation or assessment in my study. So a lot of assumptions, a lot of explanation about the exercise effect, exercise how the exercise could prevent cancer, and many factors that relate about that. So, well, I'm gonna explain and divide it into a different part of it, but well, I will not take a lot of time about this, but just conceptualize it. Well, the first is a simple explanations that we can see on the red, blue exercise versus exercise with a PIA. That's my study group that I compare them together. So for the simplest explanation, which talks about the exercise, we know that when we exercise, all the immune system are increased. So the same thing as this one of my study group, that when we exercise, all the T cells or the Treg cells or the CD28, its immune system is increased, and when they are increased, they suppress the cancer cells. Yes, in the exercise group. And well, finally, and another group that's with the PIA, exercise with the PIA. So the PIA, we assume that PIA could do something with the immune system. So, but at least, like, if we don't know, like, I didn't evaluate, I didn't analyze the gene expression, but finally we did something. We know something that microRNA is regulated, microRNA is significant. But well, you see that the exercise versus an exercise with the PIA, we know that the exercise have the effective in the cancer prevention than the other group with the PIA. And this is, we talk about the proteoglycan, we talk about glycoprotein. Well, I'm gonna go really quickly in this slide. The proteoglycan is kind of like one of the glycoprotein that's kind of huge, big family, and they have a lot of family members. So I select only 2 family members from the proteoglycan protein. One is decarin and one is biglycan, which these 2 relate to the exercise. We had a lot of assumptions about this. I mean, with my colleagues. So, so we know that normally when we exercise, the mitochondria increase in number, and also mitochondria do their own jobs, like do biogenesis, fusion, and protein import, and also we increase the lysosome during the exercise. So it's normal function when we exercise. But however, we kind of this is I'm sorry, this is a picture that I talked about, like this is the increase the lysosome when we exercise. I'm sorry. Increase the lysosome that degrade the O and defect mitochondria, and this fusion make it larger. And so by biogenesis, it's mean increasing the numbers of that and protein import during the exercise. Well, but we still have another assumptions that this is going to be our future study that, well, when we exercise, the mitochondria do the kind of job like this, but within the cancer tumor as well. If we when we exercise, we had assumption that should the proteoglycan inside the tumor cancer cell could be do something to increase all of the kind of the family members like decorin or biglycan to make a cell death or to decrease the size of the tumor. That could be one of our mechanisms that we are thinking about, that the exercise could do something with those proteoglycan within the cancer tumor cell. And also, in another group that I compared that together, it's like a non-exercise with the PAA and an exercise with the PAA. So, well, a lot of the assumptions that we thought about this kind of the discussion. But so finally we didn't analyze all the gene expression. We lost one of our result, but well, but that's okay. At least we found like a microRNA. It's kind of different between two groups, like a non-exercise and exercise. So it's mean like this is a downregulation of the microRNA 46643P. Well, but finally we know that the exercise, okay, in the exercise group, even though they both are downregulated, but in the exercise group, the microRNA it's down, I mean, less than the first one is non-exercise. So it's mean like, well, the exercise can have something with this. So we talked about this. We talked about it. SOCS genes. It's a big, huge family. And then they have like family members, but one family members is SOCS6 genes that I found in my database, in my results. So this gene is kind of regulated JAK-STAT pathway. So we kind of thinking like so when this gene is dysregulated, can cause this JAK-STAT pathway to become a negative signaling as well. And when we exercise, we will talk about when we exercise, how the exercise could help, could do something with the SOCS6 gene, regulate the JAK-STAT pathway or not. I mean, we kind of have an assumption about this, but well, but in our database, it shows this microRNA and that gene target. So what we assume that in a non-exercise with the PAA. So PAA could do something with the genes and make this gene become dysregulated. And when this gene dysregulated, it's related to the JAK-STAT pathway, become a negative signaling as well. But if we didn't talk about the SOCS6 gene, we talk only the JAK-STAT pathway. Yeah, JAK-STAT pathway can become a negative and become a can cause the cancer by itself. Is not related to the SOCS6 gene as well. And also there's just a picture that I created created, and I mean a few months ago, that talks about that. Well, to see the mechanism that SOCS6 gene regulated JAK-STAT pathway that will divide from the JAK from the JAK and go to the fundamental gene transcription. So this thing will talks about if the exercise might do something. If compare exercise and non-exercise, the exercise could do something with the genes, and this gene become dysregulated and make a JAK-STAT pathway become negative signaling. That's we assume about that. And this is just briefly talks about this, but because in the PAA group, we inject the PAA into the rat. The PAA is induced like a rheumatoid arthritis. we kind of think that, well, in the PAA group that show that microRNA are down-regulated, so we think that that could be possible in this mechanism, that when the inflammation occur, like chronic inflammation occur, we're gonna go increase the chemokine, increase the cytokine, and finally damage the DNA. And also, if the chemokine increase, will increase the reactive oxygen species and induce a cancer. So we think about that. But if we use the exercise relate to this mechanism, so what is about it? I mean, this is our future study, and this is our assumption in our in my study. So this is one that I'm talking about. In the PAA group, non-exercise with the PAA and exercise with the PAA. So the non-exercise with the PAA might relate to the previous mechanism that I shown in the previous slide, but with the exercise with the PAA might have something different, something different from the first group, from the non-exercise with the PAA, because the exercise could do something relate to change those mechanisms that I have shown in the last slide. And well, is of course the exercise relate to phosphorylation and JAK-STAT pathway. The exercise type, intensity or duration, it's related to the JAK-STAT pathway as well. And the third study group, I compared non-exercise with the exercise group. So so this group is microRNA 128 23P. It's down-regulated to ITGA9 gene. So well, a lot of sometimes we thought that, well, it might not relate because the non-exercise group, this is without the PAA. Only the non-exercise group have more microRNA down-regulated than exercise group. So we kind of assume that that could be related to the methyl group that attached to the cytosine. That could be one of the factors that can cause a gene mutation and made a cancer occur. But finally, we know that if we talk about the exercise could do something with the lung tissue and make it stronger and make it like a larger, and also is related to cardio mechanism as well. And also for the final comparative study group, it's about non-exercise versus with the non-exercise with the PAA. So so both group are non-exercise. And also in my database, it show a gene NKX21. It's kind of being a target of the microRNA 64.3. So well, both of my studies were non-exercise. So we don't see anything that relate. We don't see anything that this gene relate to the exercise. But well, one thing that we know of this gene is really can influence other genes without any daily physical activity. So it's one of their special functions is kind of they can influence some other genes. If the genes that be influenced by this gene as upregulate and like the tumor suppressor gene, so it means like when this gene influence that gene, the gene might be express that and become a arrest tumor cancer cell and later on or something like that. But well, one thing that this is very special because they can do their own I mean they can influence some other genes. So I mean, well, this might not relate to the physical activities at all. And in the group that we inject the PAA into the rat tells that when the PAA was introduced into the body might the immune system of the body might do something with that toxication and might increase all the immune system like a CD4 T cells or whatever, and then those CD4 T cells might do the job and might be suppress the cancer cell in later on. This is what we gave the assumption in my discussion. And also all the CD4 and T cell, could be suppressed or prevent cancer when the exercise cannot, when the exercise do not relate to this mechanism. That's what I gave the assumption about that. So that's all for my first pilot study, and this acknowledgement from my university, and I correlate with the Chulalongkorn University as well for finish this research. And thank you.